One of the most dreaded cosmetic problems has been one of the hardest to treat.
Well, tonight's Weight Loss Wednesday, medical reporter Meg Farris shows us there's finally a treatment that doctors believe lasts longer than those of the past.
Kimberly Usher is into fitness, but at 41, she found out something all mothers know. Pregnancy changes your body.
My husband, he can't see it, but you know, you can see it. You're your own worst enemy, I guess.
When her baby girl was only 16 weeks, Kimberly had already lost 30 pounds of pregnancy weight. But with 9 more pounds to go, she noticed something different about her thighs: cellulite.
I will not put on a pair of shorts. I will not put on a bathing suit or whatever. And people think that I'm crazy, but I see it.
Nothing made it go away.
I work out 6 times a week, and me and my husband are very active, and we're always out in the sun, and it's just something that I don't want to deal with.
So Kimberly turned to plastic surgeon Dr. Cameron Kubehi and a new device, the first FDA-approved treatment for cellulite.
This is the hardest thing to fix, the banana roll.
Weight Loss Wednesday has been reporting on cellulite treatment since '98. There have been supplements and creams, even people who swore they could brush it away. There were massage machines and even devices that infused carbon dioxide gas. More recently, external devices that use multiple treatments of radio frequency or laser and light energy.
They were not given lasting result, one, and they were not given as much as an improvement. They were given some improvement.
Cellulite makes tabloid headlines of the rich and famous, even super lingerie models. It's on the fat and thin.
Cellulite is purely genetic. Cellulite is often worsened by routine liposuction, and it's women in childbearing years that we see it the worst. The buttocks and the thighs and the hips are the predominant areas that we see cellulite.
And women mistakenly think tan cellulite is better.
Cellulite over time will be worsened by ultraviolet A because it further deteriorates the collagen level that's above the cellulite that's trying to hold it down. You disrupt that collagen with UVA, especially tanning beds, and that puckering will become more noticeable over time.
The collagen layers become degraded by sun exposure. That fat herniates out even more. So it really exacerbates the problem.
But now there's cellulase, a minimally invasive surgical procedure that attacks the 3 areas that cause cellulite. The patient is awake but sedated with a pill. In an office surgical room, the cellulase goes under the skin but does not suck out fat, as in liposuction. A multi-directional laser tip is used to melt some of the fat, as well as break those fibrous bands that connect the skin to the fascia layer of tissue, the ones that cause the puckering, and it also generates heat under the skin to grow collagen over time, making the skin thicker to resist puckering. It's one of the reasons men have less cellulite. Their skin and hair follicles are thicker.
This is not something that is going to 100% remove all the cellulite. It is going to improve it. It is going to make it better. But we cannot promise the patient that it's going to remove all of it.
One patient we talked to who just had the procedure in the morning went back to her office job in the afternoon. When the local anesthesia began to wear off, she felt some tingling and burning and achiness and decided that she was going to take a pain pill for that night, but otherwise it was tolerable.
200 patients were in the clinical trial, and after 2 years, there were no side effects. Patients just need one treatment. Special 3D pictures show after a year the depressions and elevations are gone, and an ultrasound image shows the skin is 25 to 30% thicker a year later.
It does get great reviews when you read about it, online websites, etc. Patients are saying that they're getting nice results with cellulase.
What the patients need to realize is this is an invasive, one treatment, supposedly permanent treatment for cellulite. It is potentially, as we call, a game changer.
And that's what Kimberly is hoping for, a future with her beautiful new daughter, who has a mom with beautiful smooth thighs. For Weight Loss Wednesday, I'm Meg Farris.
Now, this is a type of surgery, so the cost for the procedure is around $6,000 per area.
We have breaking news.